Hello everyone. For my Bio 139 online class, I am doing a research paper over a autoimmune disease called Sjogren's. This one hits pretty close to home with me as my mother has that, typically called Sjogren's syndrome. It is a chronic autoimmune disorder where the immune system attacks the body's moisture producing glands. The most common symptoms include persistent dry eyes and dry mouth, which can lead to a burning sensation, difficulty swallowing, and increased dental issues. Some individuals experience widespread joint pain, fatigue, dryness, affecting other organs as well. My mother just told me the other day that it has affected her eyesight, which is typically why she does not drive at night. The cause of it is not exactly known. Current research suggests that it may result from a combination of genetic, environmental, and possibly viral factors. These influences may trigger an abnormal immune response that causes the body to attack its own glands and tissues. My mother has very dry skin. Hers gets very flaky. She drinks a lot of water, one because she's a diabetic and two because of the disease attacking. So that combined within itself is not very good. She probably has had it since I was maybe 6 or 7, and I'm almost 30 years old now, so that's maybe 20 years. She started just getting really bad sick. It was attacking her immune system, and they couldn't figure out why. So I'm going to talk about some diagnostic testing you can do to see if you have it or not. It includes blood tests for specific antibodies such as ANA, anti-SSA/Rho, and anti-SSB/LA, as well as a blood cell count. My mother quite frequently goes to the hospital because her white blood cell count is down a lot, and it puts her in there. Eyes and saliva tests are also used, including Schirmer's test to measure tear production. A lip biopsy may be performed to examine the minor saliva glands for inflammation consistent with the disease. I don't think she has ever had a lip biopsy. I don't know if that's the more common way for it, but that is also one test that can be ran for it. Treatment, she takes Plaquenil. I know a lot of other patients take Plaquenil for this too. It often focuses on relieving symptoms and managing inflammation. Artificial tears and saliva substances are commonly used to reduce dryness. I'm not so sure that she does anything like that. I just know that she drinks a heavy amount of water. Medications such as the Plaquenil may help manage systemic symptoms and joint pain. Patients are typically advised to see the rheumatologist for ongoing care and monitoring. And yes, she does see a rheumatologist. The diet at home, dietary changes may help reduce symptoms. An anti-inflammatory diet can support overall health. Individuals with Sjogren's are often advised to avoid alcohol, spicy, or acidic foods, caffeine, dry environments, as these can worsen dryness and irritation. And we live in Kentucky. Sometimes it can be very, very humid. In the wintertime it gets really dry. My hands are currently very dry right now. So she has lost quite a bit of weight. My mother used to be a bigger person, and she has dramatically lost a lot of weight. So it has taken a toll on her health as far as that. The prognosis for Sjogren's disease is genuinely favorable in terms of quality of life, though it can vary widely from mild to severe. Some individuals may experience only minor discomfort, while others may face more serious organ involvements. I can say for this, it has affected a lot of her organs, especially her eyes and in her joints. She has to walk with a cane sometimes, and a lot of times it's hard for her to get out of bed. I feel like for me, it may be something that I will eventually want to have tested for myself. It's just very deep, and it can take a tremendous impact on a person's life. That person being a loved one or somebody that you do know. It can spread rapidly, and it's just hopefully in the future scientists can find more ways and more comfort they can to not necessarily prevent it, but maybe figure out a way to slow the process of it down, or maybe even figure out a cure for it. Typically, I don't think autoimmune diseases can be curable, but they may be able to reduce its factors of it. You can get a lot of this information on the Cleveland Clinic or the Mayo Clinic, Johns Hopkins. There's a rheumatology website. So I just think for this topic, I picked more closer to home. It's very rare, not really common. And honestly, when I did the research, I think it is more common in men maybe than women, which is kind of crazy. But if you have other underlying diseases like diabetes and stuff, I know it can just attack and be more severe and trigger more. Anyways, thank you all for listening, and hopefully if you know anybody that may have it or is getting tested for it, maybe this information can help. Thank you.